have no idea if that played right. It didn't look like it, but maybe it'll be fine. All right. Well, welcome back to Don't Repeat What Mommy Says.
No, don't repeat it.
Don't do it.
Mm-mm.
So I guess today we were looking through show topics on my phone just before this, and I had a bunch written down about like stuff I've seen on social media, stuff we've kind of gone back and forth. And she's looking at it and she goes, "What the hell is free birth?"
Yeah, what
So
is free birth?
today we're talking free birth. So I'm not totally opposed, I suppose, to the idea of a birth with little to no medical intervention if, you are low risk. But the whole free birth thing is basically like you don't have anyone. You don't have a midwife, you don't have a doula. It's just you. A lot of people are doing it out in weird places in nature. Um,
Because they're trying to have a beautiful experience.
Beautiful, because it's natural, and women have been doing it for thousands of years. And
Women have been dying for thousands of years.
yeah, so I definitely think that's one to talk about because I saw one lady. I've seen a lot of free birth videos popping up.
Why?
I don't know. Okay, so
I don't understand.
the one lady
Are
was,
they like filming it and then like showing everybody? Like,
yes.
Oh, come on, man.
The one lady was talking about my beautiful free birth experience after 3 repeat C-sections or something like that. She decided to have a free birth.
Was everything okay?
Everything was okay,
Thank
thankfully. But so it is possible to have a vaginal delivery after a C-section. However, there's a lot of potential risk. The biggest one being uterine rupture, which is
Horrible. That
a
sounds horrible.
life-threatening emergency. Like you would need to be treated pretty immediately.
Look at.
You're phasing out. So when they do a vaginal delivery or they call it a trial of labor after cesarean, a TOLAC. Yeah, that's the medical term for it. When they do that in the hospital, they have a whole staff on hand because while in a lot of cases it's fine, it can go south really fast. So they need to have a surgical team ready. So I don't think if you've had previous complicated deliveries, free birth should be your go-to.
Okay, here's the thing. So, back in the day, having a baby, like when somebody was pregnant, they were very happy because, everybody was trying to populate the earth and everything. So they're like, yay, we're, our legacy, all that. But it was also a very scary time because it was extremely risky. Like women died in childbirth all the time. All the time. Or shortly after. I think free birth is stupid. Like, don't do it, ladies. Yeah. I don't think you should do it. I'm not saying you shouldn't do the natural experience. Like, I understand not wanting to go to a hospital, but have somebody that knows what the hell they're doing.
And I'm not even opposed to the home birth idea, but a lot of the free birth, and I don't know enough about free birth to really know if is it a prerequisite to be outside somewhere dirty?
Well, and so if you do your research, which, why I even know this fact, but I'm a fount of useless information. Back in the day, a lot of women were dying in childbirth because of unsanitary conditions. So they would end up with an infection or something.
Yes. So one that I saw the one that really kicked it off, and then I started getting all the free birth videos in my algorithm, was a news article about a woman who had decided to free birth in a river, and she ended up with sepsis.
Well, I mean, yeah, you're going to end up with sepsis. Okay, so your cervix is usually closed, and it prevents bad things, or at least helps prevent bad things from happening. But in this case, your cervix opens, and you're in a dirty freaking river? What the?
Your cervix opens. When your placenta detaches, you have a wound on the inside of your uterus that is an open wound about that big. Possibly bigger. I think it's the size of a dinner plate. So you have a giant open wound in your uterus that is not being protected by a closed cervix. And a lot of women also have tearing. So now you have more open wounds.
And how about this? Because we know the women who are afraid to get dirt on their kid or, like their kid's going to get dirty and, oh my God, that's horrible, which by the way, it's not. But you're going to have a brand new baby coming out with their whole face under gross river water. Does that seem good? Does that seem like a good idea? That does not seem like a good idea.
And like I'm so down with the whole like water birth idea, but I think there's a reason people do like the birthing tubs and the birthing pools. It's clean, warm water. Like
Yeah, what about that too? The temperature of this poor little baby.
Right. It's coming from a nice, warm, fluid-filled womb into ice cold poop water. Ice cold poop water. Yucky.
With fish.
I mean, like, I try not to judge, but
no, I'm gonna judge
I'm
because
judging
it doesn't
that.
seem like a good idea. It just doesn't.
It doesn't.
Like if I knew nothing of germs or anything, it just doesn't seem like a good idea.
So, and let's talk about that, like the no medical intervention. So, you had a birth that had to have medical intervention. Two births that required medical intervention. Want to talk a little bit about that?
Yeah, I mean, so they were in today's day and age not that dramatic. When I had my first one, I hemorrhaged. Well, actually, I didn't have medical intervention because my medical team was stupid. And so, like, I could have died, but I didn't, obviously. So there was that. With you, Lauren was stuck. And my body was fully ready to push. But if I had done that, like, bad things could have happened to her. I mean, tearing me, whatever, but I mean, she could have, like, died.
Right.
And back in the 1800s, it's a very real probability that both of us would have died.
Well, and in a scenario where you don't, so like back in the 1800s, with a midwife who knew what they were doing, they would have recognized that
Absolutely.
I was facing the wrong way, that I was stuck. They would have been able to help in some way.
Mm-hmm.
But in a free birth situation, you would have had no idea. Like, so I asked my husband recently because I was watching something about OP babies, the face up, sunny side up babies.
Which is how you were.
Which is how I was. And they were saying when you are in labor and you have an OP baby, a lot of times what you'll have are the start and stop contractions. So you'll have a contraction, and then you'll go like several minutes with no contractions, and then you'll have more, but they tend to space out weirdly. They're really sporadic. And then you'll have a lot more back labor is what I was hearing. And that sounded so much like my experience with my second baby, with Ava, that I asked my husband, I was like, so were the kids face up or face down when they came out? And he goes, well, I didn't think that was pertinent information to remember.
They can't even remember like what day a party is. They just tell you sometime that week.
Yeah. So like, I'm not shitting on my husband. It definitely wasn't something he was thinking to even pay attention to. But he goes, I think they were both like face up. Isn't that like the normal way? And I was like, okay, so I don't know if my kids were face up, face down. Nobody ever told me. I could probably pull the medical records and find out.
I think they would have told you if they were face up because they did tell me because it was a thing.
Well, with Henry, they thought, and they didn't tell me, I found out afterwards, they thought it was a shoulder dystocia. They thought he was stuck. So, if you know anything about giving birth, you know giving birth on your back is probably one of the hardest positions to give birth in. It's really stupid.
Yeah, it is. It's stupid in most cases.
However, in the case of babies that are stuck behind the pubic bone or shoulder dystocia, there's a position they will use where you are on your back. It's to try and get the baby unstuck from under your pubic bone. So they had me in McRoberts maneuver, which is where your knees are like way up to your shoulders. Somebody's holding your legs like way up, and they're trying to unstick the baby because they thought that's why he was stuck. He was not stuck because of a shoulder dystocia. He had a compound presentation, his little fist by his face, so he got stuck. But they never told me that was why he was stuck. They didn't even really necessarily say he was stuck, and then they were like rolling me side to side like a hot dog on one of the rollers at a gas station.
I mean, I think if you want to have a baby out in nature, that's fine. Probably not the river. Yeah. But you need to have somebody that has some medical training and not be so far out that medical intervention can't get to you.
Well, and with Henry, so
do they do any prenatal care for this? Or no, they do nothing. They're just like
nothing.
They're just winging it.
Just winging it. And like I am a huge believer in like I won't do like an amniocentesis or the genetic testing or anything on my kids because unless there's something we can act upon to fix the problem while I'm pregnant, I'd rather not know. Because the way I see it, my kids, I will not abort them. Like, the only reason I would even consider it is if it was like some incredibly rare condition where my child was in pain constantly. Then I might consider like an early induction or something. But in most cases, like, that's not who I am. That's not what I'm okay with. I'm not going to abort my child. Um, so I didn't want to know. I didn't want to do the genetic testing. And I can totally understand that. But something like the gestational diabetes testing, the glucola test, you can do something about gestational diabetes. You can do something about, um, what's the term? The high blood pressure?
Pre preeclampsia.
Preeclampsia. Like, those are things you can do stuff about. So I'm cool with that diagnostic. Like, I understand not wanting to get something like the genetic testing done.
Well,
But
so do they still do the alpha beta protein test?
I have no idea.
So that's what they used to do when I had you and your sister, and it tests for that protein and the presence of that. I think it's the presence of the protein. I don't know, it's been a long time since I had babies, so I'm old, but will it can indicate that the child perhaps has Down syndrome, spinal bifida, those kinds of things, and they really recommended it. Like when I was pregnant, and I refused it, and I actually had to fight with the doctor about it because she's like, "Well, I'm like, well, what's the point of the test though? Like, okay, so what if they have that? Whatever, like whatever, you know." It I also do would not abort my children. Certainly not because they have Down syndrome or something. So I
Yeah.
didn't want to know, but the other reason that I didn't want the test, and I told the doctor, and she did agree with me. Like sometimes it'll say something's wrong when nothing is wrong, and sometimes it'll say everything's okay when there is a problem. So it wasn't even like a very definitive test. So I was like, okay, so then if you say there's something wrong, then you don't really know that something's wrong. So then you want to do an amniocentesis, and like amniocentesis can be life saving for a lot of things, but to get an amniocentesis when you don't need one, there is risks involved with it. And I was just like, no, I'm not. I'm just not doing that. Like, there's nothing here. No, I'm just not doing that. And the doctor like argued with me. So
Yeah, and I mean, I know a lot of people do the genetic testing now. Not even so much for that, but because they'll do the sneak peek
sure.
gender thing, which is super cool. Like I said,
And
if
I
you
think it's a good. I mean, there are things that they can fix in utero, or even if they can't fix it in utero, good knowledge for when the baby's here to not be surprised by it, so that they can be prepared.
yeah, so I totally understand that, but I also understand the people who might refuse some of that testing. Like, I refused the genetic testing. I have no interest in doing that. If there is something wrong, my philosophy was always, hopefully they'll see it on the 20-week anatomy scan. If they don't, we'll find out when the baby's born and we'll deal with whatever we need to deal with.
That's kind of where I was at with it. I didn't want to, if there was a possibility something was wrong with my baby and it wasn't something that could be fixed in utero, I didn't want to worry my entire pregnancy. Like I wanted to enjoy the pregnancy as much as you can enjoy pregnancy, but just you know what I mean. I figured I would deal with that. I'd cross that bridge when I come to it. But
But like beyond testing, like genetics and stuff like that, like the ultrasounds and stuff, I even get some of the people who don't want to do the ultrasounds. Like, there is anecdotal research, mind you. Ultrasounds are generally considered safe. There is no evidence that, the standard course of ultrasound. So in a healthy pregnancy, most providers are going to do a pregnancy confirmation ultrasound nowadays. They do one at 20 weeks, and then some providers will do another around like 36, 37-ish weeks. Um, and I can understand somebody maybe not wanting to do those because they've read some of those studies where they've found, like, maybe repeat ultrasounds can affect their hearing.
so
Um,
when I had babies, ultrasounds were not the norm. So it depended on your insurance provider a lot, and it depended on your doctor. So especially like when I had Paige, which things changed a lot in the 3.5 years from when I had her to when I had you. So they really only did ultrasounds when I had her if they thought something was wrong. So, because they didn't know, at that time, they didn't know the risk. There was, again, some anecdotal evidence, which then more studies were done and stuff like that, and they deemed it more safe. But they just didn't know at that time.
Well, and here's my bitch with ultrasounds. So with my first, they freaked out because he was measuring, like, overall growth was in the ninth percentile. Anything below the 10th, they start getting worried about growth restriction in the baby. And he ended up just being, it was kind of up in the air. They didn't know if he was constitutionally small or he had what was considered a true knot in the cord, which is when the blood flow is actually restricted. But the true knot was so close to his actual navel that they couldn't see it in ultrasound. They didn't know it was a thing until he was born, which is another reason why I personally will always give birth in a hospital, because he came out blue and unresponsive. His APGAR was like a 2. He had to essentially be resuscitated, and he's fine. But
But again, so, things that if you're in a setting where you have a medical team that are not that big of a deal, that was a big deal. But like
yeah,
with you, and then it just, they weren't a big deal because there was a medical team there. They knew what was going on. They did all that. Had I been at home alone and I had no medical intervention and no way to get it, we both probably would not be here today over something that nowadays is really minor.
well, and so where I was going with the ultrasound thing, I got off track there because, it was a little traumatic. I'm still a little traumatized. I'll probably be traumatized for life. Um, but what I was getting at, so with the ultrasounds, he was measuring really small. They were worried. Well, then I had my second, and she was measuring pretty normal, pretty on par. I'm pretty sure their ultrasound dating was even wrong, because I'm pretty sure I was 39 and a half weeks with her, but per their dating, I was 38 and a half weeks, and I don't agree. Um,
I don't either.
no, I don't think so. But they told me, so I had an ultrasound Monday. I gave birth on Thursday. So Monday morning I had an ultrasound. The ultrasound machine measured her at 7 pounds 5 ounces on Monday. On Thursday she was born, she was 5 pounds 14 ounces. So their machines are not always accurate. It was pretty accurate with my son. They got new machines. I think they're not calibrated. Sometimes they're just not calibrated right. So don't let that freak you out either. Like, if you are going for an ultrasound and they're saying, like,
They told me that your sister was going to be an 8-pound baby.
right,
Because I
sometimes,
ended up having to have an ultrasound because I was having problems, even though like it wasn't the norm then. And I was 7 or 8 months pregnant when they did the ultrasound, and they were saying that by the time she was born, she was going to be an 8-pound baby. She was 6 pounds 12 ounces,
yeah. So, I mean,
so a little off.
ultrasounds can be great. And I do know people who've had children who were growth restricted, and they did need to monitor that with the ultrasound. But with the monitoring with ultrasounds for growth restriction, they're not just
Why are you
looking
talking so fast?
sorry, bleh. They're not just looking at how much the baby's growing necessarily. They're looking at, are they consistently growing, and is part of their body growing faster than the other? Because a lot of growth restricted babies, their heads grow really fast and their bodies don't. So
Well, people with chondroplasia dwarfism do as well.
yeah, so I think ultrasounds are great. They can diagnose a lot of things. I also think that they can scare people a lot with what they think the weight of the baby is.
Look, I understand the appeal of a free birth. I understand that it is natural, and we've been doing this since the dawn of time. I do. I get that. And I think that medical care is entirely too expensive. So I totally agree with that. I agree that doctors sometimes don't respect you, and that's bullshit too. Like, I get that, but I hate to say at the end of the day, but at the end of the day, you want a healthy baby and you don't want to die. Like, you don't want your healthy baby to then be an orphan. So the medical community has their place. Just make sure you keep them in their place and not in your place.
Well, and like with my first, the concern was with my son. He was not well. He needed oxygen. He needed, some help adjusting. With my second, I got to the hospital. I was 10 centimeters. I was ready to push an hour later. I pushed her out in like 4 pushes over 9 minutes. It was great, beautiful, hunky dory, quick. Um, it was several hours after that that I started spontaneously hemorrhaging. And Thankfully, I was still in the hospital. I had the thought to myself, like, wow, I think that might be concerning. I'm going to show this to the nurse. She ended up having to weigh the blood loss that I had. Um, and I was being treated for the hemorrhage within, I think, 20 minutes of the start of the hemorrhage. So I was able to have what could have been a very catastrophic hemorrhage. I was treated so quickly that the hemorrhage was essentially stopped within 45 minutes.
Okay, so I'm going to share a story because I also hemorrhaged after my first baby, not my second baby. And don't do what I did. So, because I didn't know up until that happened to her, I didn't know there was something that they could do in the hospital. So what happened was they sent me home. I didn't feel good. I told them I didn't feel good. I didn't know I was hemorrhaging because I was a first baby and I didn't know what was going on wasn't normal because we just knew a lot less or I didn't pay attention. I don't freaking know. But anyway, and I was in a bad situation anyway, like an abusive marriage and all this baloney too. So I went home. I felt horrible. I went in for my 6-week checkup. I was still hemorrhaging. The doctor told me that I needed to be hospitalized. And I was so pissed off at him for sending me home with a new baby because I told him I felt like shit and nobody bothered to check into that. So I was like, no, I'm going to take my baby and I'm going to go home. I'm going to stop at the store. I'm going to get some iron pills and I'm going to take those. And if I die, I hope my family sues you. Luckily, everything turned out okay, and the iron pills did work, but it was like 4 months before I felt okay. So please don't do that. Utilize your medical team, even if they piss you off.
Yeah, so sorry, I was trying to look up something about postpartum hemorrhage. Okay, here's what I was looking for. Typically, a postpartum hemorrhage will start within 1 day of giving birth. So that can be immediately upon giving birth. Oops, sorry, bumped the microphone. It can be immediately upon giving birth, or it can be several hours later. But this is from the March of Dimes, so if you want to fact check me, March of Dimes. Um, a postpartum hemorrhage can happen spontaneously up to 12 weeks postpartum.
Holy Moses, I didn't know that.
So if you suspect that you're bleeding too much, I believe the guidance I was given was any blood clot you pass larger than an egg, or anytime you're filling more than I think it's 1 pad an hour, and not like a little menstrual pad, like the big postpartum puppy pads they stick in your underwear. Um, so
Do they still give you mesh underwear?
yeah, they do, and they're great, dude.
Mesh underwear.
My one nurse.
I can't believe they haven't come up with something different since then.
So with my first, I had this nurse. Her name was Paige, and I only say that because it's funny because my sister's name is Paige, and she reminded me so much of my sister. But as we were leaving, I was like, what stuff are we supposed to take? What stuff do we have to leave behind? And she goes, you can take anything that's an open package. So she walked in as I'm packing stuff up. I think my husband was out getting the car pulled around. And she goes, oh no, this bag of diapers is open. I guess you have to take it. Oh no, this bag of mesh undies is open. I guess you got to take it. But yeah, so anytime up to 12 weeks postpartum, you could have a postpartum hemorrhage. Those are the things to look for. Call your doctor. There are things they can do to stop the hemorrhage. So yes, you may need iron. I did have to be I did have to take an iron supplement. I still do, but I'm chronically anemic. They may have to do a blood transfusion if it's bad enough. But there are medications they can treat it. So for myself, they used Pitocin and Cytotec, which I believe is also called misoprostol. I could be wrong.
They don't care.
They don't care. I care. Um, this is my brainiac moment. There's conflicting research about the Cytotec, whether or not it actually works. In my case, the Cytotec with the Pitocin, I was still on Pitocin for 6 hours or something, but within 45 minutes of both medications being started, the bleeding had almost completely stopped.
Yeah, so I really wish I would have went to the hospital that day, but I was so pissed at the doctor. So again, my personality is great for a lot of things, but not in that situation. I was really stupid.
And if you are in the hospital and you're worried the clots are too big, I know this sounds super gross, save it and show your nurse. Because, like I said, in my case, the nurse actually had to weigh it to, calculate the blood loss, and it was significant.
So are we off free birth now?
I think we're off free birth because we got into postpartum hemorrhage. But these are things you need to think about. If you are thinking, home birth, free birth, whatever, just
I'm
have
cool.
somebody.
I get it. I totally get the appeal because doctors so piss me off.
I totally get the appeal. And quite honestly, if my husband hadn't come in the middle of the night when he heard me in the bathroom, because I was apparently in transition, didn't know it, I wouldn't have gone back to the hospital because I was pissed because they sent me home saying I was in false labor. And they said, come back when your contractions are consistent. My contractions never got consistent. But my husband at like 2 in the morning was like, get in the car, we're leaving. So I very well would have had my kid in the bathroom right there. And
I just, yeah, I get the appeal of the free birth, but I would think that probably at least have a midwife because, or so that if something does go south, they can call 911 because everything can seem okay. And you know what? You can have, like, I had very unremarkable pregnancies, which is what you want, except for the little scare when we did the ultrasound, which ended up being nothing. I was just having some pain, and the doctor wasn't sure if it was just like a Braxton Hicks situation or if like the placenta was separating. So that was the reason. But I mean, other than that, like my pregnancies were completely normal, nothing of note. And then, I have a sunny side up baby who was stuck behind my pubic bone, which again, in the hospital setting wasn't that big of a deal. I mean, it felt like a really big deal at the time because let me tell you what, if you're ready to push it and they tell you you can't do that, it's bullshit and it's not okay. And it felt pretty terrible, but it really wasn't a long period of time. They got her unstuck. She got out. Everything was great. She was perfect and happy, and mom and baby were fine. But if I had been alone in a friggin' forest somewhere, who knows how long that would have went on? I probably would have pushed and probably like broke her neck or something.
yeah, and I think like my pregnancies with Henry, they were concerned about his size, but they kind of just deduced like nothing's wrong, but we're just going to keep watching just to make sure. But otherwise, like both of my pregnancies were pretty unremarkable, but both of my labor experiences were weird and vastly different.
Well, and that's the thing. Like weird stuff can come out of nowhere. And if you don't at least have somebody who has some kind of medical training in obstetrics with you, to be like, hell no, we're pulling the plug on this free birth shit. You need medical care. I mean, eh,
Yeah, because I mean, you've got hemorrhaging, you've got stuck babies, you've got, resuscitation if you need it.
and I understand wanting a home birth or something. Hospitals suck. I mean, I don't like them. I didn't. I tried to get out of there as fast as possible when she was born. Not with Paige. I was trying to stay because I didn't feel good, and they just sent me home. When I had Lauren, I wanted to get out, and I was leaving, but I was fine. And I even understand like the no pre. So that I don't know. Should I even recommend? I'm not going to recommend this. This is what I did. I'm not recommending it. But when I had Lauren, like she was my second baby, and I often did not go to my prenatal appointments. And the doctor was a little, pissy with me because she's like, "Dude, like, what the hell? You pay the same amount of money whether you go to the appointments or not." I'm like, "Yeah, I just don't want to." And she finally was like, "Okay, like, it's your second baby. If something does happen, could you please call me?" But I went to some of them, so I just didn't feel like going. I was tired. I had a toddler.
So here's another weird bitch. I like to watch people reacting to that show. I didn't know I was pregnant, and they always talk about like all the potential risks with things that could happen because of not having prenatal care. And the one I think, I think it was cerebral palsy. They said a cause of cerebral palsy is a lack of prenatal care.
They don't do anything.
That is not
about it.
true.
No, it's not true.
So prenatal care is great for treating the things you can treat. There is nothing that is directly caused by not getting prenatal care. There are things that could be treated or prevented, like when they see the early signs of them, but those are going to be more your things like your high blood pressure, your preeclampsia, your gestational diabetes.
So basically, if you're going to be a stubborn woman like I am, who doesn't feel like going because you already have a toddler at home and you don't need this shit in your life, go to the important ones, like, take the gestational diabetes test. You're going to want to, like, make sure that your blood pressure's okay, which I did those. It's not like I never went. It's so often. I was like, come on, man, I don't need to be there again. Like, I was just there.
Well, and the stubbornness runs in the family because so with my second, I went to my doctor's appointment. I was already, 5, 6 centimeters dilated. I was having contractions. I went back to my parents' house for a bit, hung out. Around noon, I went to the hospital. They told me it's false labor, you're still hours away, and, you know, go home and rest. Come back when your contractions are consistent or when something changes. That's all they told me. And I was just pissed because, like, my contractions didn't get consistent. I didn't feel like anything changed. Screw you, I'm not going back. I didn't even want to go when my husband told me to leave. Like, I was fully, like, ready to be pissed off and just not go back. I mean, I'm glad I did, because, again, I hemorrhaged. I did end up needing to be treated for that. I did need a lot of stitches after her, not as many as I had with Henry, but still a lot of stitches. So that would have been stuff that would have been
You
tough to
didn't
manage.
have
at
hardly
home.
any friggin' stitches. She
Compared
talks
to you,
about a lot
no.
of stitches, okay? No. You don't even know what a lot of stitches is. Like,
No.
I cry on yours and your sister's birthday every year still.
I think
No, I'm just kidding. I don't still cry. But I cried a little bit. It's just a lot of stitches.
I think it seemed like a lot of stitches because I am very resistant to lidocaine. So I
yeah.
felt everything, like, especially after Ava, like, because after Henry, I was exhausted. I was beat. I was kind of, like, it hurt, but I was just laying there going, ow. With Ava, I was, like, trying to crawl up the table. I was like, get off of me.
Okay, so I think in conclusion, free birth, we're not really for it.
No,
I mean, I don't want to poop on your experience, but I don't want you to die, and I don't want your baby to die. I want you guys to be happy and healthy.
I am not for free birth for the fact that I don't want people and babies to die needlessly. I'm cool with the home births if you're low risk.
Yeah, and I
You
mean,
do.
I
At the very least, like, wherever you give birth, wherever you choose to
just
deliver
be
your baby,
smart. Just be smart.
be smart, have somebody with you who knows what to look for.
Please, and please don't be so far out in the freaking boondocks that you can't get medical care if you should need it. If you don't need it and it all goes beautifully, that's fine. Please don't do it in a river.
Yeah, so, like,
Not the river.
a lot of countries, it's very uncommon for people to
We are
deliver.
never wrapping this up.
No, we're not. And this is my last thought, okay? Other countries, they don't deliver as much in hospitals. They do birthing centers.
Okay.
They don't treat it like a medical emergency when you give birth. So, no, birth in and of itself isn't a medical emergency, but it can become one. So having somebody knowledgeable is helpful.
I think what we should do is like lobby for them to lower the friggin' price so people don't feel like they have to do free birth.
Yeah.
We need better prices, and
Yeah.
we're wrapping this up now.
We're wrapping it up. Okay,
It's getting stupid now.
we're done. We got stupid. Bye-bye.
Bye, Womp.